Previously, we knew that Koja Regional Hospital needs more supply on personal protective equipment for doctors and nurses. And sadly, there are more hospitals with the same conditions like that. With these coronavirus cases soaring, doctors, nurses, and other frontline medical workers all across Indonesia are confronting a dire shortage of personal protective equipment to protect themselves from the virus. And protective gear for medical workers in a short supply in both rural and also regular hospitals across the country. But what are actually the personal protective equipments that they refer to? We may see it through the next graphic. So here it is, the essentials of personal protective equipment needs that is really essential for these COVID-19 cases. First of all is the face shield that will cover up the face of the medical workers, and then the latex gloves that can cover up the hands and then protect it from the chemical thingy and also the microderms. And then also the hazmat suit that is really important to cover up the body of the medical workers from such germs and also chemical peeling, and also the particulate respirator. This is the one that really urgency, which can particulate the microgerms and also the virus itself. And sadly, there were complaints from medical teams about the availability of this personal protective equipment, while in reality those equipments are very helpful for our health workers and front lines, because one of the challenges is to make sure that they are not exposed by virus, and these equipments are very important. But for now, government is ready to distribute another 105,000 PPE kits to every rural hospital in the country. To get a clearer view, let's check the distributions. So here it is, the additional personal protective equipment distributions by the government. As we can see, Jakarta, Banten, and Bogor region has 45,000 of PPEs distributed. And then the next one is West Java, Central Java, East Java, and Yogyakarta, Bali area. So we can cover up that this is Java and Bali Islands that have 40,000 PPEs distribution. And then also for outside Java, government has distributed 10,000 PPEs, while another 10,000 equipments is for the state stocks of PPEs. And as we can see, the bigger portions goes to Jakarta. The capital city Jakarta, the hardest hit province in Indonesia, has received thousands of pieces of protective clothing from the National Disaster Mitigation Agency to help ensure health workers' safety when handling the patients of COVID-19. And President Joko Widodo also conveyed his condolence for the doctors, nurses, and medical personnel that have died in the task of handling coronavirus patients. They are definitely true heroes that we need right now. And he confirmed that the Finance Minister, Sri Mulyani, had calculated the incentives that will be given to the medical personnel per month during the outbreak of this plague. And let's see how much the incentives through the next graphic. So here it is, the monthly incentive to the medical personnels. As we can see, specialist doctors has the incentive within 15 million rupiah, and then general practitioners and dentists has 10 million incentive. While for the midwife and also nurse for laboring, it has incentive that reaches 7.5 million rupiah, and other medical personnels up to 10 million rupiah, and that benefit costed for like 300 million rupiah. And the government is deeply saddened to announce that a number of medical workers have fallen victims to the COVID-19 outbreak. They mourn their passing, greatly honor their utmost dedications and contributions to the country. As a matter of fact, the Indonesian Doctor Associations confirmed that 86 members had died from COVID-19 amid a worrisome trend that the fatality rate of the highly contagious virus continues to beat the recovery. For national safety, then government have urgently approved a rapid COVID-19 testing kits that allow doctors to screen patients for the virus within 15 minutes only at the clinics and the hospital. But not only that, there are other imported COVID-19 medical equipments as well. So what are those? Let's see it through the data. Here it is. Apparently, government has decided to import some medical equipments for covering the COVID-19. First of all, there are 500,000 rapid test kits that can contain it by the blood from China that started by March 19, 2020, which was a couple of days ago. And the next swab test kits that got from Switzerland, China, but will be started by the end of March 2020. And there's another 2 million packs of Avigan and 3 million packs of chloroquine that apparently government has to decide whether it's imported and also form the domestic stocks. And then the Indonesian government decided to administer chloroquine and a blue drug Avigan is a part of its endeavors to save Indonesians from the infections of this new coronavirus disease. The two drugs have evidently been sufficiently effective when it's administered in the several countries for treating COVID-19 patients. And currently, Indonesia's state-owned pharmaceutical industry, Kimia Pharma, has it stocked some 3 million chloroquine tablets. If one patient were to acquire some 50 tablets, then at least 60,000 patients would be able to receive these tablets. But however, the most effective way to prevent infections and save lives is breaking the chains of the transmissions. And to do that, we must test and isolate. And as mentioned before, that the Ministry of State-Owned Enterprises ensures that coronavirus rapid test for COVID-19 has arrived in Indonesia. But how does it work actually? I'm going to explain you through the next graphic. So here it is, the COVID-19 rapid test scheme. First of all, the medical worker collects the fingertip bloods of the suspected of COVID-19. And then turns out it only takes for like 15 minutes, then we can see if it's positive or negative. If it's negative, they can go home, while in positive, they turn it into the next process, which is PCR and swab test. Basically, this swab test is taking the swab from the nasal cavity, and then if the suspected turns out to be negative, then they can go home. But if it turns out to be positive, the suspect have to go to referral hospital to get further acknowledgement. And the first rapid test has been conducted in South Jakarta, and several of its residents might have contracted the virus. The government has also welcomes if there are offers from foreign countries to assist Indonesia in obtaining COVID-19 rapid testing kits amidst the South Asian country effort to prevent wider transmissions of the coronavirus disease. And until science offers a better remedy, seems like society must cling into those simplest and the defenses, which is praying and social distancing. Stay tuned on market headlines and also stay safe.